Dear students, now we will learn what is mediastinum. So, before starting with that, the thoracic cavity viscera, they have a relationship to one another and with the chest wall, comprehension and for understanding the function and diseases of lungs. You should have a knowledge about the anatomical position and relations of the lungs that are placed in the thoracic cavity. For understanding the structure of heart, the arrangement of various chambers of the heart and its blood supply are required for understanding its function and identification of defects in its structure and function. There are major blood vessels of the body that are located in the thoracic cavity. Rupture of these vessels can occur in case of trauma to the chest wall. Because of the location of all these major structures in the thoracic cavity and especially in the mediastinum, you should have an understanding of the thoracic cavity, the walls that are forming the thoracic cavity, with a little bit of knowledge about the dissection of the thoracic cavity. So what you are seeing here in this picture is the boundaries of the thoracic cavity. So this is the sternum and attached to it the costal cartilages and ribs you are seeing, all together forming the thoracic cage by joining with the vertebra posteriorly. And this is the superior aperture of the thorax and through which it communicates with the neck. And below is you will find the diaphragm, which separates the thoracic cavity from the abdominal cavity. And as all of you know, the thoracic cage is formed by the ribs, sternum, vertebra and the intercostal spaces between the ribs. And what you are seeing in this picture, this is a dissection image. You are seeing the rib cage and then the superior opening in relation with the thoracic cavity, and you can identify the two pleura, cervical pleura and the apex of the lungs you are able to see in this picture. In this picture you are seeing the thoracic cage, the skin, the superficial muscles, the mammary gland. The superficial muscles, what are they? The pectoralis major, minor, the serratus, anterior, those are removed. And then what you are seeing are the bony cage and the spaces in between the ribs containing the intercostal muscles is exposed. And what you are seeing here is the outer layer of intercostal muscle is the external intercostal muscle, which anteriorly it becomes the external intercostal membrane, and deep to it you can see the internal intercostal muscles, and then still deeper will be the innermost intercostal muscles, which can be seen from the inside aspect of the thoracic cage, and where you will also find the other muscles known as the subcostals and transversus thoracis muscles. So in this picture, half of the thoracic cage, anterior wall, is removed. So you can see the inside of it, and outside you can identify the external intercostal muscles and then the internal intercostal muscles. On the inner aspect, what you are seeing now is the subcostal muscle and then the innermost intercostal muscle, and the transversus thoracis muscles you can identify. So this is the cavity of the thorax, and you can identify the thoracic vertebra, the vertebral bodies and the intervertebral discs, and the inner aspect of the ribs you are seeing and their attachment with the bodies of the vertebra. Then after the removal of the thoracic cage, you can see the posterior aspect of sternum and then the transversus thoracis muscles, the intercostal spaces containing the innermost intercostal muscle, and then there is the spaces between the ribs containing these layers of muscles. Then they are seeing the thoracic cavity contains the lungs, right lung, left lung, and in between the space occupied by the heart and great vessels, and this is called the mediastinum or interpleural space between the two pleural cavities. So this is the manubrium of the sternum, and then the first rib which forms the upper boundary for the mediastinum, and you are seeing the body of the sternum, and its junction with the manubrium is the sternal angle, and you can see the costal cartilages attached to the bodies and the manubrium. Then this is the view of a thoracic cage contents. So what you are seeing is the pair of lungs enclosed in the pleural cavity, and then the space between the two pleura is the mediastinum. The pleura forming the boundary for the mediastinum is the mediastinal pleura, which is the parietal pleura, whereas the visceral pleura is closely attached to the lungs, and posteriorly you are seeing the vertebral column. So this is the mediastinum area. After removal of the thoracic cage, now what you are seeing is the contents in the cavity of the thorax, and now you can understand the divisions of thorax into. Laterally you are seeing the lungs enclosed in the pleura, and centrally you are seeing the mediastinum, which contains the pericardial cavity that encloses the heart. And what you are seeing here is the pleura. This is the parietal pleura. This is the parietal pleura, and in relation with the viscera, that is the lung, will be the visceral pleura. The space between the parietal pleura and visceral pleura is the pleural cavity. This is the mediastinum area, and you are seeing the fat, and this is the part which is known as the anterior mediastinum, which is seen immediately behind the sternum, and if you remove this fat, you can see the heart enclosed in pericardium, that becomes the middle mediastinum. This is the superior aperture of the thoracic cavity, where it becomes continuous with the structures in the neck, and in the lower boundary for the thoracic cavity will be formed by the diaphragm, which separates it from the abdominal cavity. Look at this picture for further understanding of the mediastinum. So this is the mediastinum after removal of that fat and the anterior mediastinum part. So what you are seeing is the middle mediastinum with the enclosed pericardium covering the heart, and these are the vessels coming out from the heart. Then you can see the pleura covering the lungs. So what layer of pleura? This is the parietal layer of pleura, and the space between the two pleural cavities is the interpleural space or mediastinum. Now, what are the objectives for this class on mediastinum? After listening to this lecture, you should be able to define what is mediastinum, what are the boundaries of mediastinum, what are the subdivisions of mediastinum, what are the contents of mediastinum, and the clinical importance of mediastinum. In this image, you are seeing the cut section of a thorax at the level of T8 vertebra. So you are seeing the cavity of thorax at the thoracic 8 vertebral level. And you can identify the mediastinum where you are seeing the heart with enclosed pericardium. So there is a layer known as the visceral layer of pericardium, parietal layer of pericardium with space in between pericardial cavity and the outer fibrous pericardium. And on both sides you are seeing the lungs, the right lung, the left lung, which are covered with the visceral pleura and the parietal pleura with space in between. And some more contents in the mediastinum which you are seeing here are the aorta, the agaricus vein, and the esophagus. The posterior boundary for mediastinum, that is the bodies of vertebra, you are seeing, and then this is the sternum anteriorly. The word mediastinum is derived from the Latin mediastina, which means interpleural space or mediastinal space. So here you are seeing both the lungs, the heart, and the great vessels. This is the ascending aorta, then arch of aorta, and you are seeing the blood vessels coming from the arch of aorta, that is the brachiocephalic trunk, which will go towards the right and divides into the right common carotid and right subclavian arteries, and this is the left common carotid artery, and this is the left subclavian artery. And you can see the veins. This is the left internal jugular vein and the left subclavian vein. Both will join and form the left brachiocephalic vein. On the right side, similarly, you will be seeing the right internal jugular vein, right subclavian vein joining to form the right brachiocephalic vein. So the right and left brachiocephalic veins, they join and form the superior vena cava, which opens into the right atrium of the heart. And similarly, from below the diaphragm, the inferior vena cava passes up and runs through the diaphragm, and it also opens into the right atrium. The arch of aorta will continue down as the thoracic aorta, and it passes through an opening in the diaphragm and enters into the abdomen to continue as the abdominal aorta. So now you know what is meant by mediastinal space and what is interpleural space. Now let us define the mediastinum. What is mediastinum? It is the pliable, mobile and dilatable area in the center of thoracic cavity between two pleural cavities, containing the hollow thoracic viscera except lungs. So it is a pliable, mobile, movable, flexible, dilatable area in the center of thoracic cavity, the middle of the thoracic cavity, lying between the two pleural cavities, containing hollow thoracic viscera except lungs. Why it is called interpleural space? It's covered by mediastinal pleura on either side. You have seen it in the dissection image. That's why it is called interpleural space. And how it is connected? It's connected to the lungs by the root of lungs, through which the bronchus, the pulmonary artery and pulmonary veins, they will be entering and leaving the mediastinal or medial surface of the lungs. What are the boundaries of the mediastinum? In this picture, you are seeing the thoracic vertebral column. Please focus on only the thoracic vertebral column posteriorly. This is the posterior boundary for the mediastinum. And anteriorly, you are seeing the manubrium and body of sternum and the xiphoid process. So the manubrium and body of sternum, they are contributing for the anterior boundary of the mediastinum. Then below you can see the dome of the diaphragm. So the upper surface of diaphragm is also contributing for the boundary of it. And above you are seeing all dotted lines. So they are the imaginary lines that will be showing the boundaries of the mediastinum. So above it is continuous with the thoracic inlet, where the manubrium articulates with the first rib and which will be articulating with the T1 vertebra. So that is the superior thoracic inlet, and that will be the place where the mediastinal contents will be continuous with the neck. So the upper boundary is the thoracic inlet. Below is the diaphragm. In front is the sternum and the costal cartilages that are attached to the sternum. Behind will be the thoracic vertebra. On either side will be the pleura, the right and left pleura covering the lung. So what are the contents of mediastinum? For a simplification, the contents can be categorized and can be remembered easily. In this image, the posterior surface of the thoracic cage, you are seeing so many muscles. So let us see what are those muscles. In this picture, you are not seeing the longus colli muscles, which will be on the in relation with the posterior wall and close to the bodies of vertebra. That is the longus colli muscles. And then there will be a fascia over it. That's known as the prevertebral fascia, which will extend up to the lower border of body of T3 vertebra. So that is the extent of the prevertebral fascia into the thorax. So it extends up to the lower border of body of the third thoracic vertebra. Then there is a pretracheal fascia, which is seen in front of the trachea in the neck, and it extends down into the superior mediastinum, where it fuses with the walls of great vessels, the aorta, pulmonary trunk, their branches. So they are there, with that they will fuse. And there are the two muscles which are placed anteriorly. They are the sternohyoid and sternothyroid, which are taking origin from the posterior surface of the sternum. So when we have studied about the osteology of the sternum, we made a mention of these two muscles, sternohyoid and sternothyroid muscles. Apart from that, what you are seeing is the one major vessel, that is the subclavian artery, from which comes a vessel, passes along the thorax, known as the internal thoracic artery, and the corresponding vein you are seeing. So it is running along the posterior aspect of this sternum, and this is the one which you are seeing. Then you will find some of the muscles in relation with this posterior aspect. The important one to note is the transversus thoracis slips you are seeing. These are the ones. Then you can see the internal intercostal and then the innermost intercostal muscles also will be there. So among the contents, the muscles are the longus colli, sternohyoid and sternothyroid. The fascia are the prevertebral fascia and pretracheal fascia. The other contents of mediastinum of the cardiovascular system are heart with major vessels, aorta, superior vena cava and internal thoracic vessels. Here you are seeing the heart, the major vessel, the aorta you are seeing, and this is the pulmonary trunk. This is the superior vena cava, which we have discussed. This is the left brachiocephalic vein. This is the right brachiocephalic vein, and we have seen the internal thoracic or internal mammary vessels previously. Then what are the other components? It can be seen. Behind these structures will be the trachea and its bifurcation into right and left principal bronchus. Then part of the gastrointestinal system, that is the esophagus. In this slide, we are seeing one nerve coming down. This is the phrenic nerve, which supplies the diaphragm. It is also a content of mediastinum. And you are seeing one more nerve coming here. This is the recurrent laryngeal nerve, left recurrent laryngeal nerve you are seeing. Then what will be the lymphatic system contents? This is a fetal thoracic cavity wherein you can observe the thymus, which is the enlarged gland in the case of fetus. This is the thymus gland, which is seen in the mediastinum. And then There will be lymph nodes also in the mediastinum known as the mediastinal lymph nodes. Another lymphatic duct will be seen, that is known as the thoracic duct. Then what are the nerves that will be seen? They are the phrenic nerves which will supply the diaphragm, then the vagus nerve and the left recurrent laryngeal branch of it you have seen in the previous slide. The other component is the sympathetic trunks. The serous membranes that will be seen are the mediastinal pleura, and in addition it contains the loose connective tissue and adipose tissue in the mediastinum. Now coming to the subdivisions of mediastinum. It is subdivided into superior and inferior mediastinum by means of two imaginary planes, and the upper imaginary plane is at the inlet of the thorax. So passing from the upper border of manubrium to the body of the T1 vertebra. Then the lower imaginary line is at the lower border of the manubrium, that is at the junction of manubrium with the body, which is known as the sternal angle, and from there posteriorly to the intervertebral disc between the T4 and T5. The part of mediastinum between these two imaginary lines is the superior mediastinum, and the part of the mediastinum below the imaginary line joining the sternal angle to the lower border of the T4 vertebra or junction of T4 and T5 vertebra. Lower to it is the inferior mediastinum, which extends below up to the upper surface of the diaphragm. This is the diaphragm, the curved attachment of the diaphragm. So this is the inferior mediastinum, which is further divided into an anterior, a middle and a posterior mediastinum. The heart with enclosed pericardium is in the middle mediastinum. In front of it is the anterior mediastinum, and behind it is the posterior mediastinum. The anterior mediastinum is bounded by the body of sternum anteriorly, the pericardium posteriorly. The imaginary line running in the transverse plane, the transverse thoracic plane above and the diaphragm below. There is the middle mediastinum. This is the one having the heart and great vessels coming from it. Then there is the posterior mediastinum, which contains the structures that are coming down from the heart. For example, the descending aorta, and then the esophagus that travels down to enter into the abdominal cavity. This is the superior mediastinum, which is bounded anteriorly by the posterior surface of the manubrium, posteriorly by the T1 to T4 vertebral bodies, above by the thoracic inlet and below by the transverse thoracic plane, or the one going from the sternal angle to the junction of T4, T5 vertebra. So now you know the anatomical subdivisions of the mediastinum. Now it is clear. So what is superior mediastinum? What is inferior mediastinum? What is anterior mediastinum? What is middle mediastinum? And what is posterior mediastinum? So the subdivisions will be, you can revise by looking at the superior margin for the superior mediastinum, thoracic inlet. Inferior is the transverse thoracic plane. Anterior is the sternal angle. And posterior is the disc between T4 and T5. And for the inferior mediastinum, above is the transverse thoracic plane and inferior is the diaphragm. And anterior to it will be seeing the posterior surfaces of the bodies of sternum and T5 to T12 vertebrae posteriorly in relation with it. So, for the lower boundary for inferior mediastinum can be a line drawn across the upper surface of the body of the upper surface of the dome of the diaphragm. We have seen what is anatomical mediastinum. The clinicians use a different method of subdivision of the mediastinum. They divide it into anterior, middle and posterior. No subdivision into superior, inferior and its further subdivisions, as we have learnt in the anatomy. So the anterior mediastinum is anterior to trachea. Anterior to the trachea. This is the trachea. And then this is the middle mediastinum will be posterior to the trachea. Then there is the posterior mediastinum, which includes the bodies of vertebra and paravertebral spaces, including the sympathetic chain. So the part on either side of the bodies of vertebra is paravertebral space. So that is included in the posterior mediastinum, whereas the middle mediastinum is the part posterior to the trachea. The anterior to trachea is the anterior mediastinum. So the anterior mediastinum includes the anatomical middle mediastinum. That's what you have to understand by clinical subdivisions of the mediastinum. Now you know what is anatomical mediastinum. I need not repeat it, excepting that this is the arch of aorta and descending aorta. So the descending aorta is a content of which mediastinum? Posterior mediastinum. And the arch of aorta and its branches are content of superior mediastinum. And this ascending aorta and the pulmonary trunk we are seeing in the middle mediastinum. The trachea and esophagus, they are contents of superior mediastinum. The esophagus will continue as a content of posterior mediastinum. So for a clinical subdivision, so whatever is anterior to the trachea is anterior mediastinum. All these will go into the anterior mediastinum. Then behind the trachea will be the posterior mediastinum. Then vertebral region and the paravertebral gutters will be the posterior mediastinum. In this radiological picture, you can see the anterior mediastinum in front of this shadow trachea, and then behind it will be the middle mediastinum, and in relation with the bodies of vertebra will be the posterior mediastinum. Now you know the subdivisions of the mediastinum. What is the clinical importance of it? A condition known as mediastinal syndrome. So it is a space occupying lesion, if there is a tumor, it can compress on the trachea, esophagus and left recurrent laryngeal nerves. Compression on the trachea causes difficulty in breathing. Compression on esophagus causes difficulty in swallowing. Compression on this left recurrent laryngeal nerve causes the voice change and hoarseness of voice as it supplies the larynx. The other importance is mediastinal shift. If there is a pathology of the lung, if the lung is shrunken and collapsed, the contents of mediastinum will move towards the affected side. And then if there is a air or fluid filled thorax, known as the pneumothorax or hydrothorax, then the mediastinum will push towards the normal side. So if there is a lung pathology, if it is collapsed, the mediastinum moves towards the affected side, and if it is filled with air or fluid, then it will shift towards the normal side. That is mediastinal shift. Then there is mediastinitis, is inflammation or infections in the mediastinum. This results from extension of infection from the neck because the prevertebral layer and pretracheal layer are extending from the neck to the mediastinum. So any infection between these two layers, which contains the structures trachea and esophagus, the infection can also extend into the mediastinum. Whenever there are perforations of trachea or esophagus, that can also cause mediastinitis. The penetrating chest wounds can cause mediastinitis. And coming to the median sternotomy. So a midline incision is placed in the sternum for operations for the removal of tumors of thyroid gland, thymus gland and parathyroid gland, or operations on great vessels that are present in the mediastinum. And if there is a pressure from adjacent viscera, to relieve the pressure also, the median sternotomy is performed. If there are vascular anomalies like narrowing or dilatation of the vessels, it is stenosis and aneurysms, the median sternotomy is performed. If there are congenital lesions of trachea and esophagus also, the procedure of median sternotomy is performed. Mediastinoscopy. It is visualization of mediastinum for obtaining tissues for biopsy. So it is a diagnostic procedure. Now you understand about the mediastinum, the definition of mediastinum, and the boundaries of mediastinum, subdivisions of mediastinum, contents of mediastinum, and its clinical importance.